All right, well, I believe we are all here and it is 9 a.m., so we can go ahead and call the meeting to order.
This conference will now be recorded.
And let's see, first on the agenda, introductions. I'm Nancy Wise, Chair of the Board of Commissioners.
Pat Malone, Commissioner and Vice Chair.
Good morning, Zan Ojiro, Commissioner.
Good morning, Joe Kirby, County Administrator.
Vance Crony, County Counsel.
Jeff Van Arsdal, Benton County Sheriff.
Suzanne Hoffman, Health Department Director.
Hi, April Holland, Public Health Administrator.
Hi, Justin Carley, Sheriff's Office, Parole and Probation Division.
Erica Milo, Board Recorder.
Hi there, Rick Krieger, Chief Financial Officer.
All right, welcome everyone. Next on the agenda is announcements. I do not have any announcements, but does anyone else have any announcements? Commissioner Malone?
Yeah, did you want to handle this one? A mention of Lee Lazaro's passing. Well, what I know, when I was first on the board in 2019, Lee was kind of finishing up his career as something in the transportation specialist realm, and had to retire for health reasons, but was a real champion for alternative means of getting around our area, and he's, I think, left a lasting legacy and will be missed.
Yes, I was very sad to hear of his passing. Next, we have comments from the public, and if there are any public comments, we will set a 3-minute timer. Any comments from the public? Seeing none. That takes us to reviewing and approving the agenda. Are there any changes to the agenda? Do not believe we have any changes to the agenda, other than we have a public hearing that is set for 11 a.m. So we may have to juggle if we are speeding along, and we might have to skip it and come back to it depending on the time. So I will consider that approved. That brings us to our work session. And first up is update from Department Operations Center with Suzanne Hoffman and April Holland from the Health Department. Welcome.
Good morning. I'll just turn it over to April for her update.
Hi, good morning, everyone. I'm going to go a little off our usual beaten path, and I have a presentation to share with you today. So I'm pulling up the slides now. Can you let me know when you can see them? Is it good? Great. Okay, I'm going to dive right in. So rather than the usual COVID-19 update, I'd like to talk with you all about the recently announced upcoming changes to an important COVID-19 protection, indoor masking across the state. I'd like to share a few thoughts that stood out to me as I and our public health colleagues continue to consider the changes ahead. I hope that this conversation can be a starting point for a conversation with the Board of Health, county leadership, and the health department, both regarding the path forward generally, as well as our county indoor masking order. So the Oregon indoor masking rule requirement is to end by March 31st, or when hospitalizations drop below 400 across the state. and state K through 12 masking requirements are also set to end on that date. Now, as I jump in here, I want to start by being really clear about what I'm not saying. It's important to be clear. So the following does not include these points. I'm not saying that the pandemic is over. Cases, hospitalizations, and deaths are far beyond what many in public health consider to be acceptable in a move to endemicity. Second, we can't say exactly what the future holds. We'll likely face new variants, new challenges, and if our masking order is removed, they may be called for again. And finally, I'm not here to tell anyone how you must proceed. Risks vary by individual, by the makeup of our households, and by individual activities. There's a real push toward an urgency of normal, which I understand, but also have concerns about the possible costs associated. And importantly, the fact that many people are not ready for that. So I'm not going to tell you that you need to learn to live with the virus, not embracing a fatalistic view. We are not all going to move toward the shift out of crisis we're beginning to witness at the same rate. We all have different experiences that shape our lives, different risks, a different set of circumstances that we face on a day-to-day basis. The key points that I'd like to cover with you today are this big shift, the U.S. Sort of moving out of crisis mode and into something that looks different. Masking rules, donning and doffing are medical terms. Donning is putting on your mask and doffing is taking off the mask. It's easier to ask everyone to put them on than to lift masking mandates. Importantly, we want to look at, share with you all the data that we've been considering. And of course, at the center of everything in public health, we want to consider equity. So first, moving out of crisis mode. Nationally, key aspects of an effective pandemic response, communication, trust, and a shared sense of threat are slowly dwindling. There are several complex trade-offs that leaders must consider, and no simple path forward. Our hospital system, a staggering number of deaths, disruption to life, the economy, well-being, so many things to consider here. We must consider our overall goals. In public health, that includes limiting death and severe illness while protecting those most vulnerable to the worst impacts. We're all shaped by our experiences, our environments, our individual risks, and our values. Without a joint sense of the risks, it can seem increasingly hard to move forward with a shared view of what the end of a crisis looks like. Masking, we know that masking works. Masking indoors reduces coronavirus transmission. The question is when to discontinue it. In a surge, many agree that the harms of the virus outweigh concerns about masks. Outside of surges, there's less agreement over the benefits. So first, let's get through the surge. An analysis I find helpful is to remember your doctor's advice when you're prescribed antibiotics. It's important to finish the whole course and don't stop when you're starting to feel better. Removing masks when cases are starting to drop really does nothing helpful. It'll only create more strain on our already strained systems. Looking to data, I'm going to spend a little bit of time going through each of these pieces. Calls to end universal indoor masking should be grounded in good quality data. Vaccine uptake among those eligible, community prevalence of disease, and hospital capacity are all keys. I've also included a few extra pieces that we've been looking at here. I've been poring over data, consulting with county staff, outside colleagues and partners, reviewing actions across the country and beyond, and importantly, doing my best to put aside my own biases. My primary concerns lie around leaving vulnerable people behind when risks remain elevated and or could be demonstrably reduced. So I'm going to jump into each of these points. Hospitalizations, overall vaccination rate, availability of therapeutics, community transmission, and vaccination eligibility for our youngest citizens. So here's where our hospitalizations are right now in the state. It is a welcome sight to see hospitalizations on the decline. 865 people right now across the state are hospitalized, down from 1,130 at the peak of this wave. In our region, there were 167 people hospitalized yesterday, down from 205 at this peak. And we had just over 20 hospitalized in our local hospital. So this is trending in the right direction. I'm including an overview of vaccination, but I have the primary vaccination series data up here. And why look at primary vaccination when we have boosters available? If our goal moving forward is to protect against severe illness and death, the primary series continues to provide very good protection in that regard, particularly in younger age groups. So right now in Benton County, we have 72.2% of the entire county with their primary vaccination series complete. You see the number there to remaining to reach 80%. And I think that's a reasonably attainable goal. Boosters, we're up to just about 50% of everyone in the county having received a booster, including and 66% of everyone who's eligible in the county has gotten a booster. So there's more work to do there, but those are rates to be proud of. They're much higher than many areas. Going back to that goal of 80%. We currently have 5,122 people who are partially vaccinated in Benton County. As part of the reason I think that this is a pretty attainable goal. We're also considering a records discrepancy. Many of our OSU students, although they're residents here, they were likely vaccinated elsewhere. We know that the vaccination rate at OSU is quite high, but the data that we have indicate that our 18 and 19-year-olds aren't very well vaccinated, and we know that's not true. So we're working on rectifying the data here, and I think that'll bump our vaccination rate up a bit. And the importance of a high vaccination rate, of course, in our community is enhanced protection for all of our community. One of the many considerations of removing masking requirements is the availability of medical advances to prevent and treat SARS-CoV-2 infection. Of course, we have vaccination. There's also other treatments, monoclonal antibody treatments, and newer antiviral therapies available. We know that these are currently limited, but are available here in Benton County. And as we get closer to that March 31st date, supply is expected to increase as time goes on. Again, these are just all of the things, some of the things that we've considered in this new announcement. And then looking at the rate of transmission in our community is still valuable. Looking at case rates is certainly imperfect right now, but due to in a surge, you may have less testing capability. Many more people are relying on rapid antigen tests. However, even with the Omicron surge, we saw first increased positivity rate, and then increased cases, and then increased hospitalizations, and then deaths, unfortunately. So this is our 7-day case rate per 100,000. We are on our way down, which is really, really wonderful. Our cases in the past week, the week of the 6th, decreased by about 37% relative to the previous week, and over 50% drop in the 2-week period before that. Relative to the rest of the state, Benton County has among the lowest testing positivity rate at 11.5%, indicating that we're finding cases decently well, but has among the highest case rates right now. There are only 5 counties with higher case rates, and some of that might be because we're doing a better job of finding cases. Nevertheless, we're on our way down, and we expect that this trend should continue. Of course, we can't say exactly with certainty where cases will be at the end of March. However, with a conservative estimate of a 25% weekly reduction in reported cases, Benton County would reach the moderate community transmission category, which is between 50 and 99 cases per 100,000, and the threshold for CDC where they condone lifting of indoor masking sometime in early April, and that's 25% is pretty conservative there. Next, we know that the FDA asked Pfizer to apply for emergency use authorization for its COVID-19 vaccine for children ages 6 months to 4 years of age. And then upon submission of the data last week, FDA determined that additional data is necessary before moving ahead. It's important to have a vaccine with a known effectiveness before administering it widely. And I know we'll get there. Unfortunately, we'll have to wait a bit longer. We can protect our little ones by protecting those around them. And there's about 3,500 in this age group here. We're hoping that in April we'll see a resumption of this. And I just want to share that I'm one of the parents who is heartbroken by this decision, even though I understand it. So many families are eager for the opportunity to reduce the known and unknown risks of COVID infection for their young children. And I understand the frustration. Many of us have spent a long time constantly weighing risks, have avoided or delayed activities, and have ordered takeout for so long that sitting in a restaurant or going on a date with our partner seems like a dream. Parenting during the pandemic has been one of the hardest jobs I could have imagined. It's important to remember that we all want to keep ourselves and our loved ones safe, despite our differing points of view. And I try to remember that as I move through this experience. So equity and social justice are truly at the heart of public health. With the masking debate, considering the needs of the vulnerable has often been labeled an or proposition. We either take care of everybody or we look after the vulnerable. And it's taken me some time to come to this, but in public health, we've always done both. It must be an and, not an or. And so I don't want to get sucked into a false choice that it is one or another. We must find a way to do both. In an environment without indoor masking, how can we protect the vulnerable? Here are some ways. By providing high quality masking that can be effective in an environment where not everyone is masked, by continuing to ensure access to vaccination with extra precautions for staff and visitors at long-term care facilities, with universal masking in healthcare settings for now, and with ensuring availability and access to therapeutics. Okay, to wrap up, I just have a few final thoughts here. What could happen in April? Number one, of course, we'll continue to recommend that certain people continue to wear masks in public indoor settings if our local order is discontinued. Those who are unvaccinated, immunocompromised, have underlying health conditions, are 65 and older, or people who live with others at high risk of severe disease should continue to mask. Required masking may end, but masking will not be over. Many will continue to mask to protect themselves, to protect their loved ones, to protect their communities. We really have got to do more to share the masks to use that are effective for use when others around are unmasked, and to have those accessible to those who need it or want it. And then the second point, you know, we've grown accustomed to making decisions based on the risk involved, answering the question, what should I do today? Population level interventions are much more straightforward. But in our changing circumstances, we really need to arm people with evidence-based solutions in this landscape. You know, we know that people have vaccination, a booster when they're eligible. They can mask. They can look at what activity they are going to embark upon to determine what layers they may put on and make those decisions based on risk. And for example, if someone is 38 years old and healthy and boosted and lives alone, they may decide to not wear a mask in periods when cases are low. Or moderate. They may use rapid tests before attending family gatherings. We want to do more in providing examples of this, and there are some good risk estimators out there as well. Another example is if it's the same person, but they live with their 85-year-old mother, they may choose to wear a mask in indoor public settings to help protect their family member. The last point here, you know, I want to clarify that while cases and hospitalizations should continue to drop dramatically, it does not make sense for us to discontinue masking when we're reporting 6 times the high threshold of transmission and our hospitals continue to be strained. It doesn't make sense to us in public health. The data in no way support ending mask mandates at this time, and I'm so glad that Oregon looked ahead compared to some areas. In the future, cases will likely ebb and flow. It's our job here in public health to have a pulse on what's happening and what may be coming, and to share it with our communities. So as of now, we look outside, check the weather, still a pandemic out there. And then for right now, you know, we have more than 20 people hospitalized with COVID in our local hospital. Many more in the region across the state. Community transmission remains very high. I said this to this body at the head of the Delta wave when the local masking order was adopted. I said, we're at yet another critical juncture in the pandemic. We now have the vaccines and it's time to add masks. We know how to stop the spread. We have done it before and we must do it again. And here we are again at another critical juncture. You know, we know that SARS-CoV-2 indeed is likely to be with us for the longer term, but as I mentioned at the head of the Delta wave, it doesn't mean that we need to wear masks forever, or that we should take a fatalistic approach to the virus and give up. At this point, our path to more normal life lies with sufficient vaccination to reduce catastrophic outcomes, both in our communities and across the world, as well as utilizing these new therapies, using testing, what we've learned about ventilation, and enhancing our sick policies. We know that COVID isn't the flu. It's different in many ways, and it's ended 921,000 plus lives in our country and devastated many families since the pandemic began. Our cases, hospitalizations, and the numbers of deaths are expected to be in a much, much better place soon. And when that happens, remember that masking is one of many important layers of protection. We have vaccines, therapeutics, testing, and a supply of high quality masks that offer protection to those who need or want it. when the masking rule is lifted across the state, and if it's lifted here in Benton County, I know I won't be alone in assessing my individual risk and continuing to wear a mask, perhaps for some time to come. We in public health will be there with data to help support the community and help support decision making. So that's what I've got for today. I just wanted to open that conversation. It's a big one. This has been a really challenging shift for many of us in public health, and it's been a challenging shift for me personally. So I am grateful for the journey, and really eager to have more conversation with the board and county leaders as we move ahead. Thanks.
Thank you, April. Are there any comments or questions for April? Commissioner Ogerow, and then Commissioner Malone.
April, I wanted to thank you for putting together this presentation about risk and values, because that's where we are now. People will look at the data and see different things, and I'm very grateful that we are looking out at least 6 weeks before we face that lapse in the statewide indoor mask mandate. And I'm listening really carefully to what people are saying around me, and the opinions are very diverse, even from my own family doctor. Significantly less risk averse than some in public health. So thank you. I think that to me, what's going to be most important is where our numbers are as we approach that end of March deadline. And not what the state numbers are showing, but and I'm looking forward to getting that calibration of our vaccination rate for those college-age kids who may have gotten their vaccinations elsewhere, so that we have a more realistic sense for the risk here locally. I do think we test ourselves more often, and we have much better access than in some communities. I also am seeing that start to slip a little bit because some of the insurance agencies are not covering it anymore. So I think that testing is going to change also as we move forward. So thank you for opening this conversation.
Commissioner Malone.
Yeah, I really appreciate the slides and the charts. It's a little easier to put the information in context. And slide number 8, hospitalizations, and I was trying to figure out where the drop would be at the end of March, and so I'm assuming there's some hope on people's part that we will be in a good, relatively good place by the end of March as far as hospitalizations and case rates. I think you mentioned, well, it might be into April a bit. And I think part of the message should be, well, March 30th, wear masks and be careful. And March 31st, we're all good. And happy days are here again. And we sang that song, I think into last June, early July, when things were looking pretty good. And that's what the chart says. And then I guess Omicron takes off. And so anyway, appreciate evidence-based solutions. That seems like a wonderful phrase. Maybe we should make up bumper stickers that to say how we're proceeding. But This was very helpful. Couple of questions. Any reports from the FEMA vaccination clinic? What the numbers look like? Or I mean, I drove past there a time or two, and it seemed like they were doing some business. But that's curious if you had numbers yet on what kind of response that got.
Thank you for your comments, Commissioner, and for your questions. Yeah, so you mentioned hospitalizations. Yes, there is some modeling there to look at statewide hospitalizations, and the goal for the state is to go below 400, which would put the hospital systems in a more stable place and out of crisis mode. You know, at this time, we still have crisis assistance, crisis level assistance in many of our hospitals, and help from outside agencies, the National Guard, et cetera. We definitely need to get below that point. Yeah, and the number of cases, you know, as I mentioned, the case counting is becoming more problematic as we move toward using rapid antigen tests more frequently. But I still think that they're a good sort of bellwether at this time anyway to see where things are. And yeah, just looking at 25% decrease for the next several weeks does put us into, I think, the second week of April. However, our last few weeks have been bigger jumps than that, bigger decreases. So hopefully we can be pretty well in line with that date. But of course, we're going to keep watching closely. Our FEMA clinics were successful. I mean, for 2 weeks, we had the bus out there for several hours every day. There was at least 100 every day, and we finished off with a bang with over 200 vaccinations on the 13th. I'm sorry, on the 11th. I don't have exact numbers for you though, but it was, oh, and there's John saving the day as usual, 1,257 in total. Thanks, John.
Great. I guess the last thing is looking further ahead. I remember after the first year of COVID and talking about the flu season that was very light. And so hopefully we can carry some of those lessons forward. And you know, the idea of coming to work sick may not be quite as appealing as it was pre-COVID of, oh, I can tough this out and potentially infect the rest of the office with whatever it is that I have. So just things like that, hard learned lessons, but just how to, especially in the wintertime, how to cut back on transmission of whatever's going around. Really appreciate this report today.
Thank you, Commissioner. Yes, we've had many lessons learned and lots of bright spots and ways that I'm looking forward to applying so many pieces of wisdom and rainbows in the storm to different parts of public health, including, you know, embracing our sick time and enhancing those protections for people where we can.
Thank you, April. Suzanne, was there anything you wanted to add?
No, not today. Thank you, Commissioner.
All right, thank you so much. As always, we appreciate your time and information that you put together for us. All right, moving along. That brings us into our business meeting, and we have the consent calendar. Do I hear a motion to approve the consent calendar or remove something from the consent calendar?
I would move approval of the consent calendar.
I'll second that.
All right, all those in favor say aye. Aye.
Aye.
Aye.
Motion carries and is approved. Next up, we have the public hearing, but that's at 11, so we will skip over that for now and go into new business. We have discussion and consideration of adopting names for the meeting rooms at the Calapooya building. And we have with us Johan, our Equity, Diversity, and Inclusion Coordinator. Welcome, Johan.
Good morning, Commissioners. I'm excited to be presenting to you all today. I just have one little second. I need to final up this presentation. There's an error that happened, so I'll just take another minute and I'll be ready to go. All right, thank you for your patience with that. Okay, so I'm excited to be presenting to you all the Calapooya conference rooms. We will have a secondary presentation coming up, but wanted to get this on your all's radar so that we can get these named as soon as possible, at least for our phase 1 rooms, because IT needs to get those so then we can reserve rooms in those spaces. So the purpose is so that we can provide names for the Calapooya conference rooms for easy recognition and reservations as we are using those spaces. We wanted to make sure we are honoring local history as we are choosing these names, and with a focus on people with marginalized identities and their impact to the Benton County and Oregon communities. We wanted to avoid, where possible, repeated recognition that the cities, Oregon State University, and other community partners have already given. And where relevant, we wanted to have these names relate to the departments that we're using the spaces. So we have 2 different phases of the development for the building. So as you all know, we just have gone through phase 1, which includes these rooms available here. So we have our conference room for the Commissioner's office, as well as the public meeting rooms. And that room is able to be divided into 2 different spaces. So I was asked to create names for room A and room B. And then for the second floor, we have the shared conference room between records and elections and assessment. And then for phase 2, still in development, we have a variety of different rooms as well. So that includes 2 rooms for IT, so their training space, as well as their conference room. And then the finance conference room, the community development, HR, the environmental health department room, and then a presentation room as well. So quite a lot of rooms for phase 2. So for today, I will be focusing on phase 1 rooms, and I'm still working on creating a list for phase 2 rooms. And we have really a choice for you all to make. We can either do temporary names for the phase 1 rooms so we can get these reservations done, or we could just approve the phase 1 room names that I have presented to you all today, and then we can approve the phase 2 rooms when those are available to be named. So here are the different presentations I have for the different rooms we have. So first is the public meeting rooms, and I found a really great representation we can have present for the record for these 2 of a married couple from their time here living in Benton County. So Mary James Holmes and Reuben Ficklin Shipley were 2 Black Oregonians who had moved here to Oregon, and both were enslaved by 2 different families. And Mary Jane's family, Robin Holmes, her father had been enslaved by Nathaniel Ford, and he had promised to free Robin and his family once they moved out west and settled, but then was resistant to that until Robin sued and got freedom for his children. And one of those children was Mary Jane. Mary Jane then moved down to this area, and she was living and met Reuben Shipley, and together they lived in this space. So he had moved from in the South as well. It came here and was able to get his freedom from his former enslaver. And then he kept their last name and also was sometimes referred to as Ficklin, which is another previous enslaver last name that he had. So he has both Ficklin and Shipley throughout the historical records. So they married and they bought land here in Benton County. He and Mary Jane had donated some of the land to Mount Union Historical Cemetery because Black and white people were not allowed at the time to be buried in the same lot. And they stipulated that that will be a integrated space where anyone can be buried. So Mary Jane was later remarried after Reuben died, and she continued her time here in Oregon. So I recommend these names because it's a great way to honor two really great historical figures for Benton County and the work that they've done. And we've gotten some really great work over at Mount Union Historical Cemetery in Philomath, but wanted to make sure that we honored their history there, especially considering Oregon's anti-Black history, where Black people were not even allowed to live in the state. So these two were already resisting that law at the time. And now we can continue that legacy by saying, here are these public meeting rooms, and a really great opportunity because these are shared spaces where they can be individually honored, but then also honored in their union through the room reservations when it's reserving both of those spaces as well. So that's our first room. The second one is Harriet Forrest Moore. So she was a U.S. Army Medical Corps member who was reconstruction aide for physical therapy, and she worked at Oregon State University when it was called Oregon State Agricultural College in 1920 and studied there as well. So after 30 years of working around the country, she returned to Corvallis and recorded a bunch of information for Benton County cemeteries after request from the Daughters of Revolution. She began working at OSU in their library as one of the first staff members of archives and one of the first women doing that type of work in the state. So she helped students with their research and insisted that they read their first drafts to ensure that they're historically accurate, which I think is an excellent point for that. So I thought that was a really great name that we could bring to be honored by the Records and Elections and Assessment, since that really fits the work that she was doing and naming that space after her. I'm sorry, I don't have a picture of her at the time. And then lastly is our Board of Commissioners conference room named after Jack Yoshihara. And Jack Yoshihara was one of the 42 Japanese American students who was attending Oregon State College during Executive Order 9066, which made Japanese Americans and their descendants have to move to internment camps throughout the country. Jack was an OSU football team member, and he was part of the 1941-42 team that made it to the Rose Bowl. However, due to restrictions where the game was moved to North Carolina, he was not able to attend because he wasn't allowed to leave the state. The coaches tried everything they could, but even the FBI got involved, and they told them that they were not able to give any travel restriction exceptions. So a few months later, once the executive order had been issued, he moved to a temporary camp in Portland and then moved to Utah, where he worked in Idaho for a bit and then went to Utah to finish his education. But then in 2007, a law was passed that allowed people to receive honorary degrees for their time when they were interred. So he received his honorary degree and his Rose Bowl ring. And I think this is another way we can recognize the work that he's done to the community and really represented OSU and or just Benton County and Oregon in general, being one of the few people in Oregon who was impacted by this really horrible experience, and to really acknowledge that we have such a diverse community and we want to celebrate him. And he is actually one of the only people on this list who is still living, so it'd be great to even invite him once we do a grand opening to be part of that ceremony. So, so then the rest of these names we're still in works for. So I have a short list available, wanting to really spend some more time to get that going so we can really put some really intentionality behind that. I've been working with Gabby over in Public Works to get some names as well, and trying to find some other populations such as LGBTQ people, people with disabilities, and a variety of other marginalized populations that we can recognize in this work as well. So those will be part of the phase 2 collection that I'm working on for you all as well. So any questions for me, and then we can explore motions.
Commissioner Boudreau?
I wanted to thank you. I found, I've new stories of the first few people, but not of Jack Yoshihara, and I have to say, it was moving. So I'm hoping that when we do name these rooms, that we also have a brief bio and a photo of each of these individuals at the door, so we can continue that educational aspect of the naming work. And I really appreciate the work that you've put into it with your colleagues.
Thank you. I would love to have that recognition on the buildings for these people, because I think that would be a really great way to continue honoring legacy well past our time here.
Commissioner Malone?
Yeah, similar comments in my student days, having taken a lot of history. I think it's important to know where we came from, so we have a better idea why we are what we are in present day. But, and I really like the Shipley and Mount Union Cemetery. I've known of the cemetery for quite a while, but only recently found out about the history. So I would echo Commissioner Ogero's comment about having that, at least a short history and maybe where to get more information if you're interested. Handy in the specific rooms that are being named, but I think this is a good start to the naming process, and appreciate your efforts. So thank you.
You're welcome.
Yes, thank you, Johan. I really appreciate all the work that you did on this, and I learned something today, and I appreciate the fact that there's women listed in here as well. So I would be in favor of moving forward with this.
If we're ready, I'll make the motion. I move to approve Phase 1 conference room names for the Kalapuya building.
Second.
All those in favor say aye. Aye.
Aye.
Aye.
All right, motion carries. Wonderful.
Excellent. I'll be in work with IT and other staff to get these recognized. Thank you.
Thank you, Johan. All right, let's see. That takes us to old business. We have discussion and decision to approve the 2021-2023 M57 Supplemental Fund Program and Intergovernmental Agreement number 6187. And I have Captain Justin Carley, Probation and Parole Captain, on the agenda, and I believe he is here with us today. Welcome, Captain Carley.
Hi, thank you. Thank you for having me today. So I am here to ask approval for an application of a funding source for community corrections through the allocation of Measure 57 dollars. These dollars that are allocated through the state of Oregon, and the Department of Corrections has a process where they facilitate to the communities, to the field. And these dollars are made available to counties with a formula similar to our community corrections, our grant and aid allocation. And these funds are flexible enough for us to do general community supervision, deal with risk assessments, deal with our COG programming, re-entry subsidies, and then housing subsidies. And there's a longer list as well. The dollar amount, comparatively speaking to our overall budget, isn't a large dollar amount, but it is close to $125,000. And I wanted to bring this to the Board of Commissioners as well after I went through the exercise of having the Department of Corrections get eyes on the application and kind of see where they were with it and what they thought of it in terms of how we were planning to use these dollars. And so now that brings me to this point here where I wanted to bring it before the Board of Commissioners. And also answer any questions too that you may have about the use of these dollars, or just any questions in general about our community corrections programs.
Commissioner Ojero?
Just a couple questions. One of the points that you make in your description of the Measure 57 dollars is that we've seen a drop in caseload because of Measure 110. And I was wondering whether you could describe that a little bit more. Has it been steep? What are you seeing?
So it has been steep. I just can't tell you that it's specifically because of ballot measure 110. I know that every time I go to a community corrections directors meeting, there seems to be an agenda item where they're talking about the impact of the criminal justice system in general as a result of ballot measure 110. I know that we overall we have seen a decrease in our overall office caseload. And we just know that we're not on an island, though. We know that the overall office caseload numbers in the state have just continued to decline, whether you're one of the big 5 counties or whether you are a county like Benton County. And I just couldn't tell you right now if there's specifically X, Y, or Z that is the sole reason. I do know that the ballot measure 110 impact does exist for us. You can definitely see the impact we've received too in terms of just simply the number of folks that we're receiving on probation. And it just is not, it's just not like what it had been. And I could even share some of the data that is shared with the community corrections directors, and just in terms of the trend for not only you as an individual county, but just the trend for the state as well in terms of overall office caseloads. So we're at an all-time low. But if I would say that, it would sound maybe unique to us, but I regularly am sitting in front of other directors saying, yep, so are we.
Okay, and that's because of the shift away from misdemeanor drug offenses to violation. And I know that some of those misdemeanor drug offenders were on our probation and parole caseload, and some weren't, depending on the severity of their other activities. Correct?
Correct. Yeah. So we're still continuing to supervise domestic violence caseloads, or excuse me, domestic violence, misdemeanor domestic violence, sex abuse, misdemeanor cases, and DUIs.
Okay. Thank you for that clarification. And the only other question I had was whether the core agreement with the state here, whether there are any changes in it whatsoever, or whether it's pretty much standard agreement.
In terms of the IGA that's tied to this, yes, no, it's just a standard IGA that accompanies every Measure 57 application.
Okay, and I would love to see the statewide data and that underlying data on caseload declines. Thank you.
Yep, you bet.
All right, any other questions or comments? All right, would anyone like to make a motion?
I'll move to approve the 2021-2023 Measure 57 Supplemental Fund Program and Intergovernmental Agreement number 6187 between the state of Oregon and Benton County.
Second.
All those in favor say aye. Aye.
Aye.
Aye.
Motion carries. Thank you, Captain Carly.
Thank you.
All right, and I just want to take a quick 5-minute break. We'll come back at 10 o'clock. All right, it's 10 a.m. and we are all back. We can move forward with item 7.2, discussion and decision to approve the notice of funding opportunities process with Rick Krager, our Chief Financial Officer. Welcome, Rick.
Good morning, commissioners. How are you? Good to see you today. So again, for the record, Rick Krager, Chief Financial Officer for the county. I'm here today to follow back on the American Rescue Plan Act, and more specifically related to the notice of funding opportunity that we've been talking about over the last several months. Before I do that, I also want to offer a thank you to all of you for approving on the consent calendar. I know that consent calendar doesn't always get a lot of limelight, but I'm very excited that you approved the grant coordinator position. I think I speak for Jen Ambu, who's also on the line. We both have been carrying a lot of this, and we are quite excited about getting a grant coordinator that not only will help carry this work forward, but also really be, I think, instrumental as we move forward with our reorganization and really moving towards more of a grant management effort. So again, just wanted to pass on my thanks for that. It's very much needed, and we're excited about getting that going. So first of all, just a quick thumbs up. You can see the screen okay, I assume. Okay, excellent. In your packet, as I think I mentioned to you via email, I provided you a copy of the notice of funding opportunity that we had been working from. I provided you what I call the red line version, so you could see kind of all the edits and changes that have been made since we started this discussion back in December, and then a clean version, and then also included a new attachment, which I'll talk a little bit about, which is our a rubric. But I know that's a lot of information, so hopefully this PowerPoint will kind of sum it up for you a little bit better, and not require you have to look at all of that detail, but certainly always happy to dive into that as necessary. So I guess to start with, as always, I like to try to provide a little recap just to make sure we are kind of grounded in what we have been discussing. Obviously, back on December 21st was the first time that I come before you to present the notice of funding opportunity and the proposal to put a portion of our ARPA dollars out and be able to solicit that through what would be a competitive process. We talked a lot about needing to gain input from our community partners. So we scheduled between December 27th and January 11th. Thank you again for advising me. I had a pretty aggressive schedule initially, and you had recommended I might want to consider going out a little longer, and you were absolutely right. But we got good feedback. It was good information that we got from all of our partners. I think there was a lot of appreciation for the time spent to really just follow back and listen to folks and be able to think about what they had to say. And then, of course, consider that, which is what we did on January 10th. Came before you in the goal setting meeting to talk a little bit about that feedback. You all provided very excellent thoughts and opportunities that we might want to look at. And that's really where I'm here today before you to try and review that, and hopefully we approve it and be able to move forward. I do want to apologize. I think in that plan I had hoped January 25th was the date that we were going to come before you to get this approved. As I think most of you know, I had a little adventure in Mexico that kind of threw things off a bit. And so my schedule got a little out of alignment. So we are here today, and I'll talk again about what that means as it relates to our schedule going forward. So let's start with the community partner feedback. This is all information that we talked about back on January 10th. Again, to summarize some of the feedback we heard, 1-year timeline to expend funds, particularly for capital projects, seemed a little short. There were concerns regarding the government organizations being eligible to use the dollars. There was questions that were raised about how funds would be allocated to ensure geographic distribution. Another concern about priorities being a little broad, that trying to figure out, should we be narrowing those? Should we try to align with U.S. Treasury priorities? concerns about small nonprofit or community-based organizations may be challenged to effectively compete, and that particularly came up around the maximum grant of $500,000. Commissioner Orgeron was good enough to point me towards the Benton County Community Foundation, which they provided me some really good feedback, and I'll share those thoughts with you here shortly. Striving to maintain a process that is simple, flexible, that was a concern that we heard. And then I think the piece that we'll talk a little bit that I think probably has the most extensive change was around equity and focusing on that, and really being really specific in terms of naming populations. So what I'm going to do is take each of those areas. I'm going to, again, this is my attempt to summarize this a little bit so you don't have to go through that red line version and see everything. So I'll talk about each of these and then tell you what has actually changed from the version that you originally saw. So let's start with the one-year timeline to expend funds, particularly for capital projects being too short. So first, one of the things that we talked about on January 10th, we changed the requirement from expend in 1 year, because there was a concern about getting those dollars out the door, to obligated within 1 year. So what that does is within 12 months, they actually have to physically either have a contract in place, they have to have services dedicated. What we then did was change the period of expended funds to June 30th of 2024. You might remember in the conversations we thought about, I think Commissioner Orgeron, you're the one that pointed out that, well, maybe we should go 12 months. And that's what I initially had. But then when I thought about it, is 12 months really is only 3 months short of when we actually have to spend these funds per our agreement. So I went ahead and changed this to June 30th, 2024. That's essentially 15 more months. I think as we move forward in the future rounds, those are going to be a little bit tighter in terms of how we adjust those time frames. There was another comment about capital projects. I think Commissioner Wise was pointed this out about, hey, if this is capital projects, we might want to really encourage applicants to apply early and not wait. So we did add a footnote to the NOFA to really encourage applicants, if they have capital project funding, to really consider this first round or no later than the second round of funding. So to again point out clearly as we move along, if our plan keeps continuing in round 1, 2, and 3, you're going to have shorter times to be able to actually get these dollars expended. So those were the changes made in relation to that. The second area, concerns have been expressed regarding government organizations being able to apply. I think you all were very clear in the January 10th meeting that we really wanted to maintain that. We want to give government organizations also opportunity to compete. I think the thing that's important on this is that this is really focused on community priorities. This NOFA doesn't go to the level that ARPA does, where you can spend it on a variety of things, governmental services, because again, your prioritization of this NOFA is really looking at what the community has said. So again, if a government organization, and I think we talked about the city of Corvallis and perhaps economic development being one of those examples that, hey, we want to be able to get to that particular priority, and we want to make sure all organizations that are able to hit that priority have that chance. So no changes in relation to that. The questions regarding geographic distribution. So one of the things that you all pointed out wasn't crazy about going and saying, okay, X% for rural, X% for urban. However, we want to recognize the importance of that. And one of the things that you will see different, and again, Commissioner Orgeron, you were really clear on this, we should really put the rubric in there. And so you now see in attachment A, the actual application rubric that we will use to evaluate these. And it's really clear that we will give higher rating to those proposals that identify geographic distribution and the importance of it. We're not asking exactly what that geographic distribution is, but we outline that that is an important feature to the applications. It's important to us. And for those that really define that more specifically, we would give them further credit. I'm sorry, Commissioner Orgeron, you have a question?
Yeah, I'm happy. I'm fine if we come back to this after you finish presenting. But with respect to that rural urban, it's reflected in the community impact component of the rubric. And as I read it, it says it sounds like every proposal must address both rural and urban rather than be either one or the other. And I'm uncomfortable with that because I
Okay.
don't want to see dollars, spread out just for the sake of spreading them out. I'd rather see them, address a specific need for a specific community. And I think it's really going to be up to our team of reviewers to determine that we have the geographic coverage that we want. So I'd like to just take a look at that language a little more carefully.
Okay, I will make a note, and Commissioner, we can come back to that at the end on changes that you would like me to make before approval and play with that a little bit, but your point's well taken. Okay, so moving on to funding priorities may be too broad and consideration should be given to narrowing. Again, I think you all expressed comfort in what we were doing, and that yes, there was some broadness in there. It wasn't nearly as broad as we could have been, but it really reflected the priorities. I think we also, I believe Commissioner Malone had also said, part of this too is this first round is understanding on, lessons learned. If there are changes that we want to make for future round, if we need to be more narrow, we need to be more broad, whatever the case may be. But this seemed to be a good place to start. I did add some just minor language to really be clear that, this is about programs, this is about services, this is about projects. It's not really trying to tailor anything specifically. So that was language that was added. The next area was small nonprofit or community-based organizations may be challenged to compete with larger organizations. So this, again, as I mentioned earlier, I reached out to Benton County Community Foundation, had a great conversation with them because, and they were very clear to say they also have kind of run across this as a concern, but that concern hadn't necessarily materialized in the way, was initially expressed. And they've handled it in a couple different ways. One, I think it was the feedback I got was very clear that the larger grant sizes, the larger organizations aren't always the best applications. And so that's something that, again, just because it's, again, a larger organization coming in, they've seen actually some of the better applications with the smaller amounts. The other approach that they have taken is tiering these to be a small grant versus large grant. But also we're not dealing with a whole lot of dollars here. I think in the conversations that I have with them that they felt like, again, going through this process, being very clear in what you're trying to accomplish in your review rubric, and that you will find that it usually works its way out in terms of smaller versus larger organizations. I think the other piece, though, and that was brought up by you all, and this kind of goes to the second bullet, is scalability. And so if you have a large project that comes in, is there the ability to scale that and be able to understand, all right, well, if it's $500,000, could you do $200,000, and could you scale back to that? And so that's something that we've built in to get information on, and that we're expressing that is an important element. And in the case, we find ourselves in a situation where maybe there are several large grants, we would have the ability to scale those back and be able to create more balance. So the last two areas, maintaining a simple flexibility evaluation. Again, that is really the principle that we're trying to go on here. Lots of kudos to Jen, who I think, several months ago showed you the tool that we'll be using. This will be a pretty simple tool that they will be able to gain access. We are trying our hardest not to require them to get a whole bunch of additional information, to be able to actually just go into the online application and respond to the questions and not have to include a lot of additional attachments. And outside of a little bit of more budget detail, we're trying to keep this very, very simple. Again, as it relates to the evaluation and the ongoing reporting, clearly we'll have to follow the U.S. Treasury rules on this. But again, I think, as I mentioned to you at the last meeting, the final rule that has come out really creates an opportunity for us to have a lot less reporting requirements. And so we're really trying to maximize that as we move forward. The last area was focus on equity and being more explicit. And so one of the things that Johan had provided to me when I first went through this was actually, it was a really good presentation from the U.S. Treasury that talked about how counties, local jurisdictions should really think about equity and how they should require applicants to really name it more specifically. So what you will see is I've kind of reworked this a little bit. Clearly, Section 4 is still focused on our values and what we want to accomplish. But we've also said, you know, we want to essentially lead with equity. We want everything that you do, regardless of what priority, we really value this. This is going to be given a higher priority. And we went through and also named, and this all comes from the U.S. Treasury guidance, different ways to address equity, as it may be taking on racial equity. It could be inclusive in terms of including communities of color and others in terms of making decisions around prioritization of those resources. It could be focused on low income portions of the area. So again, you don't want to give them the specific answers, but we want to say, this is what we want to lead with. This is the lens that we want you to look through. And we expect you, when you respond, to be able to weave this in. And oh, by the way, we're going to give prioritization to any that do this very well. These are all going to be given higher priority. So I really tried to bolster that a little bit more and tried to be consistent with the equity principles. Some other quick changes for you that were non-specifically related to the community input. The funding amount is slightly smaller. It's 2.4. And I think, as I mentioned to you, I've been working on a lot of the non-NOFA projects as well that we've talked about to get estimates revised. So I had to tweak a little bit. That will likely still adjust as we go because we have, you know, cushion on this. But again, keep in mind, we are not allocating all the resources. We still have money banked for round 2 and round 3. And then as we learn more, you know, you may decide you want to flex that a little bit more. Already mentioned the application review rubric is added as an attachment. There's some additional requirements that I put in there that are really more specific to federal regulations. Subrecipients have to follow those CFR type rules, some of those specific things. And then I also updated to really bring in the final rule from U.S. Treasury. As you might remember, we were operating on the interim rules, so did a lot of updates in relation to that. And then the last thing, minor updates of clarity. Vance was good enough to look through this for me as well, just to kind of give me a legal perspective. And so tried to incorporate as much as I could. I'm sure there are probably little edits that maybe I missed. Eric was good enough to find one that was really important earlier that I've cleaned up. So our hope is to get this as ready as possible for release. So let me just quickly bring you up to date. You know, I provide this because Joe can maybe use it for my performance review because you can see where I missed my marks here. So you can see what the original plan was as it relates to what I presented to you in my more aggressive approach. We've completed the first 2 tasks. We're here today to present the final NOFA and hopefully gain your approval. If all goes well, I'd like to release this this week, February 18th. Application close date would be approximately 3 weeks. I think everybody was, at least the community feedback that we got, 3 weeks seemed to be ample enough opportunity. And then we would be looking at reviewing all those applications with about a 2 to 3 week window. And then the goal to come back to you on April 5th with recommendations for funding. And then, of course, we'd have to execute grant agreements. So you can see 17 days. Little off from what I initially had planned, but not too bad, and still getting the dollars out. So let me just real quickly talk about next steps, and then happy to take questions. Where we're at is right now hoping to gain your approval and for this final draft. If that goes through, either approved or maybe there's a few modifications, we would do a press release, working with John V on that and preparing for that. We would announce this, the NOFA to go live on Friday. We would be posting to the homepage to ensure that applicants could see it as they come to the homepage. The NOFA would actually be placed on your site to be able to go to. At that point, it would provide instructions in the NOFA, as you already see, for them to contact Jen. Jen is going to be the keeper of keeping a user access to the actual application and being able to monitor that carefully. We would also be sending emails out to all those community partners that we've already gone out to, again, to make them aware. And then again, next piece is really kind of getting the review committee. And if we have some time, would love to talk a little bit to you about that and any thoughts that you have. I know Joe and I have kind of brainstormed a little bit about what that could look like, but we would certainly appreciate any input. So with that, that concludes my presentation, and happy to answer any questions, make any changes, adjustments, whatever you like. So I'll turn it to you.
Commissioner Ojero?
Thank you, Chair Wise. I do have a couple more questions about the way we are interpreting our evaluation criteria in the rubric. And then the next one is really about community impact. No, not community impact, but organizational capacity. Two things. The scalability in that evaluation criterion is expressed as small or large populations. And, you know, the projects can often be scaled in really different ways. If it's a smaller addition on a facility or a larger one, or it is, it's not the number of people that might change that you will be touching, but the dose of whatever it is that you're providing that changes. So I think putting it just in terms of population, to me, is a bit artificial, and it may be constraining, because there are various ways to scale a proposal or project. Might be the number of seminars that are offered for small businesses or whatever. The other piece of that is that according to this rubric, the highest number of points if the requesting organization provides the same or similar program or project or activities on a consistent basis. And to me, that says that we are looking for the same old, that it's you know, it's what that organization's always done. And it's, I would really hope that with these funds, we are, you know, some of it is the same old. We need to provide childcare, that no doubt about it. But for some things, maybe we need to be innovative. Maybe we need to be creative to try and get, you know, be a little more strategic and address underlying social determinants of whatever challenge. Or so I'm uncomfortable with giving the highest number of points to something that's been done that way all the time by that same provider. I understand what you're getting at, but I think we need to find different language.
Okay, so Commissioner Ojero, just to kind of summarize and make sure I've got this captured. So as it relates to scalability, recognition that scalability is more than just population. It's more than just large and small. It could be scalability of a variety of different types of inputs. So I can certainly, and I think that's a great point to be able to address that. As it relates to in terms of your comment related to same old, and I get exactly what you're saying on that. I think it's sort of that balance between, all right, well, we want to make sure the organization knows what they're doing and is able to has a proven track record, but at the same time, we don't want to dismiss innovation. We don't want to dismiss new ideas. And so let me see if I can work some language into that and be able to kind of address that theme, because I think what I hear you saying, Commissioner, is that you still value that, again, you know what you're doing. That's what we want, but we want to somehow be able to reward innovation and new ideas and new ways of thinking.
Exactly. Thank you.
Thank you. Great feedback.
Commissioner Malone?
Yeah, Rick, I really appreciate the adjustments that you've made to, I think, improve the process, and it looks like our suggestion to give folks a little more time to get through this process, including ourselves, was a good suggestion, and you took it. The Benton Community Foundation, it just has 3 words. There's no county in there, so it took me a while to learn that. So don't feel bad.
Sorry about that. Thank you for the catch.
And keeping the application process, well, not just the application, but the whole process is simple and still achieve our goals. It seems like a very worthy goal, and I think that'll help the smaller outfits that will be engaging in the process and not get overwhelmed with paperwork and how do I get through this and still keep the organization going on a day-to-day basis. I like the ideas of is your project scalable? I had one comment of, well, you $500,000 maximum, then you're only going to do 5 grants, and so, well, no, that wasn't the idea, but it was up to 500,000, and depending on how applications come in, we might want to see if we can dial that back and still get the job done. And along the same lines, kind of fine tuning the total dollar amount to fit our budget. I appreciate that flexibility, and it's still a significant amount of money, and but we have to be mindful. This is one of many opportunities that we're trying to achieve with ARPA dollars. So, but I think overall the process seems thoughtful, and appreciate that.
Yeah, Rick, I just also want to say thank you for this, all the work that's been done on it. I can tell a lot of thoughtful time and energy has gone into it. And I really appreciate your presentation also. It was a great way to sum up and refresh our memories of all the information that was listed in the packet. That was very helpful. So thank you for that. I don't have any other changes that I would like to see. I guess my question is, so we have a couple options. One option was to approve it today. Another option is to make recommended changes and then recommend the release at the time that that's finished. So I just want to double check with Commissioner Ojero, since you were interested in seeing some changes. Are you comfortable with that? Did you want to see it again before we release it?
I am comfortable that CFO Krager understood what I was trying to convey, and that he and Jen will be able to come up with language that will reflect that.
Great.
Commissioner Wise, maybe one last clarification. I know Commissioner Ojero mentioned geographic distribution. I don't want to lose that either. I think I look at it as 3 kind of items to address. One around, let's make sure on geographic distribution we're not saying that, okay, we want to see you spread it out between rural and urban. But we want to recognize the importance of knowing, of being able to have a focus on what is the need for that particular area. So that was the other one I wanted to follow back on. And then The other two I already previously mentioned, I think, we have good understanding. So I feel confident that we can come up with some language that captures exactly what the commissioner has brought on, and then, if necessarily, maybe just run it back just to kind of get some separate feedback if that's acceptable, to be able to make sure we hit the mark. But yeah, no, that would be great, Commissioner, if that is the pleasure of the three of you to do that. And again, I think we're poised. I believe we can easily make these changes within the time frame and be prepared to put this out on Friday.
All right. Any other questions or comments, or would anyone like to make a motion?
I'd be happy to make,
I have
I'd be happy to
Commissioner
make a motion.
Ojo making a motion. Pat, did you have another comment, or were you just going to make the motion?
Make the motion. My comment was I think I would like to keep to the revised timetable if at all possible.
All right, Commissioner Ojo.
I move that we approve the notice of funding opportunity as discussed and modified today by the Board of Commissioners, and recommend release upon completion of that modification.
I think add the date of February 18th.
That's fine. I'm happy with that addition.
I'll second that.
All right, all those in favor say aye. Aye.
All right.
Aye.
Motion carries.
Commissioner Wise, just so first of all, thank you for this. We will move forward on this one. Just last little housekeeping piece, as I mentioned in sort of the last part of the agenda, the next one of the next responsibility for us is to establish our committee. And Joe and I had some good conversations around, what's the best mix of committee members. Some of the feedback I've heard from the Benton Community Foundation is, not going overboard in terms of your committee members. 5, odd amount is good, 3, 5, 7, but trying to keep it, as manageable as possible. Also looking at, how do you get, diverse opinions. And I think one of the challenges is, as I've mentioned to Joe, is that it seems like a lot of people are interested. A lot of organizations are interested in this. So there could be a lot of applicants. And so how do you, choose people that aren't actually have a conflict of interest in all of this? In the discussion that Joe and I had, we were thinking through, okay, how do we represent equity? How do we represent, someone from the county? How do we represent someone from community organizations? Maybe do we consider philanthropic organization representative? Do we consider a state representation? I mentioned that, we have a state perspective on this as well that administers a lot of these ARPA dollars. So I have some contacts that could be very non-biased but helpful in terms of ARPA dollars. So would just love any thoughts that you might have as we start to put that together about representation as we move forward in the process.
Are we still considering using our community members of the budget committee as the core of this committee?
Yeah, I apologize. And that was one of the things that Joe and I talked about is as we looked at, other representatives, we did talk about, do we have a representative from the budget committee potentially be one of the review committee? Or I think what you're suggesting, Commissioners, or do we just use our budget committee as it is? Is that correct?
I would not use our budget committee as it is. It's only 3 people, the community members. I would, if anything, augment that with other representatives. I like the idea of, say, using our budget committee, maybe bringing in one of your colleagues from the state level. The budget committee is all male. I would love to see a little bit better gender balance there. We don't have, well, we do have one Latino member of the budget committee. We don't have any of our Black community represented or other parts of the Indigenous people of color community. So I would be looking for a little bit more diversity in addition to our 4 budget committee members.
Any other thoughts in relation to the recommendations on committee makeup?
Commissioner Malone?
Yeah, number of members, I think 7 might make sense, especially if you're going through quite a few proposals. Because if you started with 5 and then somebody couldn't make a meeting, then that's 20% of your committee. So, I like the idea of bringing in one of your contacts from the state to bring a different perspective and maybe not have the community connections that could raise the specter of conflict of interest or just so I thought that was a good addition and I'm not sure what pool you're looking at, but I think maybe asking Johan if he would be interested in participating would be a good way to get some diversity and a little different perspective to the group.
And I'm going to say, I think I would prefer to not have the budget committee as the core. It's not a hill I would die on, but I think it could be good to get some more diverse opinions or, outside input rather than people that are, that we are used to hearing from. I don't know. Like I said, I could live with it. It's not a big deal, but I just think it might be good to include people that we don't normally include, if that makes sense. And maybe having, if we did go that way, they could even have a joint meeting with the budget committee members and solicit input from them. I don't know, just an idea.
Commissioner, can I ask you to expand on that a little bit, real quick, if you don't mind? So when we're talking about the potential of budget committee members, are you opposed to one member of the committee being involved, of the budget committee being involved, or you're just opposed to all members being involved?
I'm somewhat skeptical of having all members involved. But, I could go along with it. Commissioner Ojo?
Point out that 2 out of our 3 budget committee members are new and have not been involved in this kind of decision making for the county for a long period of time. So I don't have the same trepidation about them being total insiders. So I think that the more opportunity we have to engage our budget committee members in decision making about how we spend our funds, the more vested they are in being active and proactive budget committee members. And because our budget is biennial, they only get involved every other year in any substance. And I like the idea of continuing to educate and engage them.
Sure, that's a good point. And also we might want to ask them if they would like to, or if they have the time, since they might not be expecting to be involved in that way. Commissioner Malone?
I had a similar thought to you, Nancy. I guess I wouldn't necessarily recommend having the 3 budget committee members put on the review committee and to see what other choices you have, and if there's 1 or 2 members from the budget committee, I think that would be fine. But I guess I wouldn't start with 3 members automatically.
Rick, is this something that you need direction from us today, or can we mull it over and talk about it next week maybe?
I think I have time, Commissioner. I wanted to start the conversation though, and the applications is as we're the closing date will be the March 11th, and so we have a little bit of time that we could come back, and I could based on the feedback. I guess I just wanted to get an idea where you were at. Joe and I had a good conversation yesterday. I think him and I can put our heads together on what we've heard and sort of come up with a proposal on what we could use. One option would be to extend the invitation to the budget committee members as representatives of the community. If we did go with the number that Commissioner Malone had suggested of 7, it would seem that maybe not all of them will want to participate. And but I think I definitely heard you say diversity is something we should think about and really trying to get that representation. So maybe if we have a chance to think about it a little bit more based on what you've said today and then be able to come back, I think I should have enough time. Joe, are you good with that?
Rick, yes, I think one of the things we might need to think about is coming back to our information sharing meeting next Tuesday. I'm a little bit worried about not giving these folks a long enough time period of a heads up. So I think we need to either come back next Tuesday at the board's information sharing meeting or at the very latest, come back to the board on March 1st.
So I'll just shoot for next week if that's acceptable, Joe. I can check with agenda, but yeah. And then, like I said, we can sort of kind of come together with maybe some ideas and thoughts to share with you.
All right. Thank you, Rick.
Thank you very much.
Any other comments or questions for Rick? Seeing none, I have one more comment, which is just, I really appreciate this process. I think this process has been great. It's a good example of transparency and reaching out to the community and asking for feedback and then pivoting and listening. And I am really happy with it. So thank you, Rick, and thank you to your team. Pivoting and being flexible is a virtue. So we changed the timeline. That's okay. Thank you. All right. Next on the agenda, let's see, it's 10:42. That was the end of our regular agenda. Is there any other? Don't see any other. So our public hearing is set for 11 a.m. So we, unless anyone else has any comments or questions, we can recess until 11 a.m. Vance, would you like to chime in?
Nope, I just wanted to make sure, I heard you say that we reached the end of our regular agenda, and I just wanted to make sure we didn't prematurely end before we get to that public hearing.
Perfect. You just wanted to make sure I wasn't screwing up. Thank you.
No, ma'am. No. You wouldn't do that.
Oh, I could. Okay, well, we will recess then until 11 a.m. All right, it is 11 a.m. and time for our public hearing.
Nancy, you're muted.
Now you tell me. Okay, let's try that again. Sorry, I'm missing my double screens, trying to switch back and forth. Okay. In the matter of a public hearing and potential first reading amending Benton County Code Chapter 36, illicit non-stormwater discharges, ordinance number 2022-0308. We have with us Gordon Kurtz, Public Works, and Greg Verrett, Community Development. And I will open the public hearing and I will read the wonderful script that Vance sent me. Tuesday, February 15th, 2022 at 11 a.m. is the time set for the public hearing in the matter of amending Benton County Code Chapter 36 to incorporate national pollutant illicit discharge system elements and update other elements of Chapter 36. All testimony, arguments, and evidence received during this public hearing must be directed towards the subject of the proposed code amendment. The hearing procedure will be as follows. 1, staff will present the staff report. 2, any member of the public wishing to present general testimony will be given the opportunity to speak. 3, testimony from any representative of any other governmental body. And 4, staff response. Please try to avoid repetition if someone else has already expressed the same thoughts. It is perfectly acceptable to state that you agree with the statements of a previous speaker. If you have documents, maps, or letters that you wish to have considered by this body, they must formally be placed in the record of this proceeding. To do so, either before or after you speak, please submit the material to Erica Milo, who will make sure your evidence is properly taken care of. Finally, I will ask the board if any commissioner needs to declare any bias, conflict of interest, or ex parte contacts. Seeing and hearing none. All right, and with that, we will jump into the staff report.
Good morning, Commissioners. Greg Verrett, Community Development, and Gordon Kurtz.
Gordon Kurtz, Public Works Engineering.
I'll just make some introductory remarks. Gordon, you can feel free to color it in or correct. Commissioners, we had a work session on this item, just last week. And presented the general overview of the matter. So this is part of our new permitting requirements through the state Oregon Department of Environmental Quality requirements for our stormwater program. One of the elements is to update our illicit discharge code in a variety of ways. We have made those updates as well as applying this to the entire county rather than only the urbanized area, which is the area that the minimum DEQ requirement is for. At the work session, a couple of items were discussed. We've incorporated those changes in terms of clarification of definitions, and I think there was one subcategory that was inadvertently deleted around one of the exemptions or non-exemptions. Anyway, as discussed, those changes have been made into the latest draft. Gordon, anything you'd like to add?
I guess the only other thing that I would add is what you added to my preamble last Wednesday, is that we've tried to clarify who the contact folks are, who's responsible for these efforts, and to make it easier for us to work interdepartmentally to respond to these issues. There's a lot of areas where Public Works doesn't have jurisdiction but community development does, or EH does, and it's important that we be able to share those duties with one another based on our jurisdictional authority.
Thanks, Gordon. Yeah, so commissioners, any questions or areas you'd like us to go through in more detail?
Commissioner Malone?
Yeah, just, well, I guess one comment, and I appreciate Gordon just mentioning jurisdictions and trying to make that more seamless, which seems like a good idea. Just out of curiosity, I guess, how long have you been working on this project?
I started working on this in 2002. The initial phase 2 requirements were just coming into effect. Phase 2 being the communities of 100,000 or less, were just coming into effect when I started working for the county. And we've been through several iterations of this, of the NPDES permit process, which have taken protracted periods of time because they got hung up in court a couple of times. We worked under the initial permit for, I think, twice the duration of what the original planned permit was. The permit that came around in 2011, it took almost 8 years for that one to be renewed. And interestingly enough, on that line, in conversations with DEQ in the recent past, I check in with them at least 2 or 3 times a year. It looks as if the next permit that will be issued after our compliance is complete at in February of next year, this time next year, will likely be far less onerous. They've basically established the permit as it should stand at this point in time, and any changes to it will be relatively minor, which means that once we get through this next phase of compliance, we will probably not have to come back to you all for major changes to the code. And so really what that indicates is that this sort of 20-year process is finally winding down and is finally sort of settled into what we will call routine, at least for the time being.
Yeah, I appreciate that. I didn't know it had quite that much history, but it just seemed like a significant body of work, and so I appreciate the long and painful history that that this has been through. Thanks.
Commissioner Ojero?
Thank you. Yeah, I also appreciate the broadening of our chapter on this topic to include all of the county, and the added clarity by defining stormwater conveyance system, and it does include a lot, and I think that's good for the purposes of this chapter. I have one speculation to throw in as we move forward, and that is that as water becomes a scarcer resource, I suspect that we may see some changes in the way we handle gray water issues. And that's something that I would expect to see coming down the pipeline as we move forward. But yes, I think this is a great set of amendments. It makes our process smoother and clearer.
Your mention of gray water and the scarcity of water in general, I'm going to take this opportunity to step up on my soapbox a little bit. An important thing to recognize about stormwater discharges and about non-point source pollution in general is that, as you know, we've been in a drought cycle for about 5 years now, and a lot of the major pollutants that get flushed into our rivers and creeks and waterways in general happens in those first rains at the beginning of the fall. Well, in drought conditions, when you have lowered water tables and lowered reservoir levels, et cetera, that flush of pollutants in that first flush creates a much higher concentration of pollutants in the water, in the receiving waters, than we have experienced previously. And that is of significant concern, especially when it comes to the types of things that are washing off of our highways and into rivers and creeks for fish health and aquatic life health in general. And so as climate changes, so do these pollutant loadings. And we're going to have to be careful with gray water and its use to be sure that it doesn't exacerbate those kind of pollutant concentrations that I just got through talking about. So I'll step off the soapbox now. I've taken enough.
Yep, it's going to be a whole other set of challenges to deal with as quantities of water and quantities and toxicity of pollutants changes, but I think we have a good framework.
All right, any other comments or questions for staff? All right, let's see. Do we have any members of the public wishing to present testimony? I am seeing and hearing none. Do we have any testimony from any representative of another governmental body? Hearing and seeing none. Which I believe means we do not have a staff response. All right. So any other comments or questions, or would anyone like to make a motion? Commissioner Malone?
Yeah, I moved to wrong page. So close. Where was I? Oh, I got lost here.
Page 43.
43. Thank you. I'll move to approve the proposed amendments to Chapter 36 of the Benton County Code and to conduct the first reading of ordinance number 2022-0308.
Second.
All right, all those in favor say aye. Aye.
Aye.
Aye.
Motion carries.
Do you
Vance?
want to do the first reading?
Sure.
Sure. Before the Board of Commissioners for the State of Oregon for the County of Benton in the matter of amending Benton County Code Chapter 36, illicit non-storm water discharges, ordinance number 2002-0308. Now therefore, the Board of County Commissioners of Benton County ordains as follows. Part 1, short title, amendments to Chapter 36 of the Benton County Code regarding illicit non-stormwater discharges. And that is the first reading. The second reading will take place 14 days from today, which would be March 1st. And then the ordinance would take effect 30 days following that second reading.
All right, and I think I should close the public hearing. It is closed. Make it so. All right. Do we need to do anything else?
No. Thank you very much.
Perfect. Thank you so much. We really appreciate it. All right. And thank you. Does anyone else, Commissioner Ojro?
Oh, I was just waving goodbye.
Oh, all right. Well, everyone have a great, it's not quite afternoon yet, but have a great day and a great afternoon. We will adjourn the meeting at 11:14 a.m. Bye-bye.